Major challenges facing the profession of nursing include nursing shortages, patient satisfaction, and faith and religious beliefs.
Nursing shortages. The profession of nursing continues to face shortages due to lack of potential educators, high turnover rates, and unfair workforce distribution. Nursing staffing levels are extremely important to the quality of patient care and improving care outcomes. Shortages can also be caused by the older nursing workforce approaching retirement with low amounts of new nurses to replace them. Disadvantages that come with nursing shortages: errors, morbidity, experiencing burnout, and dissatisfaction. Advantages to proper staffing: reduced length patient stays, reduced mortality rates, and reduced number of preventable events like falling and infection. Nursing shortages and safety. Patient safety is the prevention of healthcare errors and elimination of mitigation of patient injury caused by healthcare errors. Without the proper nurse staffing, it could cause the nurses to become more fatigued and would limit them from using their skills to their full potential. Self-care is also very important because without the right amount of nurses working, more mistakes are about to happen and they may not have time to focus on the evidence-based clinical decision-making needed to minimize for potential harm.
As you can see, low staffing increases the risk for injury. Patient satisfaction. Patient satisfaction is the extent to which patients are happy with their health care, both inside and outside of the hospital. A measure of care quality, patient satisfaction gives providers insights into various aspects of medicine, including the effectiveness of their care and their level of empathy. Patient satisfaction can have a positive effect on several parts of healthcare organization, including improving patient retention rates, securing a positive local reputation, and preventing possible malpractice lawsuits. In order to have patient satisfaction, you need to have communication, which is the exchange of information, thoughts, and feelings among people using speech or other means. Effective communication requires an understanding. Effective communication is essential for improving health outcomes and patient satisfaction. Aspects of communication are feedback, appropriateness, efficiency, and flexibility. Errors with communication are failing to see the uniqueness of the individual, failing to recognize the wants and needs of the individual, giving false reassurance, failing to clarify, and failure to use a professional interpreter if the patient has limited English speaking ability. One of the main errors with communication is the language barriers. 76% of nurses claim that there was no interpreter support when they needed it. Effects of language barriers are the provision of appropriate, timely, safe, and effective care to meet patients' needs. Prevention of language barriers are simple charts and interpreters. Another issue is miscommunication. 80% of nursing errors are attributed to miscommunication. Effects are reduction in quality of care, poor patient outcomes, wastage of resources, and high healthcare costs. Prevention of these issues is speaking clearly, being a good listener, asking follow-up questions, and being aware of the patient's wants and needs. Prevention of poor communication is strong verbal and written communication skills, which are essential to improving healthcare outcomes. By preventing these issues, the nurses are fostering relationships with coworkers, patients, and families, navigating complex situations.
This is your patient, Lawrence. Can you just give her the meds on the table?
Yeah, sure. Thank you. Dr. Quiggs, how's the cure coming?
Working on it.
Danielle, how are you feeling today? Good. All right. Danielle Lawrence. I'm gonna go grab your meds.
Doc?
Culture and diversity. Culture is a pattern of shared attitudes, beliefs, norms, roles, and values that occur among those who speak a particular language or live in a defined geographical region. Diversity references a broad range of individual, population, and social characteristics, including age, sex, race, ethnicity, sexual orientation, and more. The registered nurse population is 80% Caucasian women. The lack of diversity could affect the ability to give the best culturally competent patient care.
A diverse healthcare staff gives patients assurance that they are in an environment in which healthcare providers will treat them regardless of their differences. Issue and prevention. A common issue amongst nurses involve faith and religious beliefs. Some religions and cultures may be against certain ordinary hospital duties. Some people may refuse things like medication, blood transfusion, surgeries, and food. It may be difficult for a nurse to understand and respect the patient's wishes when their decision could negatively affect their health. If nurses could understand others' cultures and religions, it may make it easier for them to accommodate for their patients. Hi Walter, how are you doing today?
I'm alright, how are you?
You're due for a blood transfusion from our friend Will.
Oh, actually, I don't know if you know this, but I'm a Jehovah's Witness, so I can't do that.
I don't know what that is, but you're due today for blood. Can you not take it from Will?
It's honestly insulting that you don't know this about your own patient, but that's not gonna happen. I can't go against my religion.
So what do you want to do?
No blood transfusion. Bingo.
Most problematic challenge. We feel that the most problematic challenge is nursing shortages. Without the proper amount of nursing staff, there's space left for mistakes and errors to be made, and low patient-to-nurse ratios leave the patients dissatisfied and the nurses themselves burnt out.
Protecting the image of nursing. Nurses can protect the image of nursing in many different ways. Communicating effectively and taking time to talk and listen with patients, keeping a positive attitude, dressing professionally, never publicly criticizing patients or people you work with, being confident, showing that you have pride in your profession, speaking up and advocating for your patients.
Plans to meet these challenges. As nurses, it is important to communicate and come together to use our voices and make a difference in the working field. We can do this by participating in educating organizations, speaking out and advocating for changes, educating patients, and advocating for yourself and patients.
First, you will